Hi there, my name is Shannon Cavanagh and I'm a second-year mechanical biomedical student at the University of Alberta. In this video, we're going to discuss how mechanical engineering innovation in the biomedical world is influencing the public welfare in Alberta in 2016 and in the future. Specifically, how Edmonton has facilities such as the Glenrose Hospital and an educated workforce to benefit Alberta in the realm of rehabilitative technology. We will also discuss the BLINC lab, which is an interdisciplinary lab where medical, science, and engineering researchers collaborate to improve the control and performance of robotic prostheses such as the bento arm and the handy hand. The Glenrose Rehabilitation Hospital exemplifies what innovation means in their mission statement. They state that they wish to maximize function and quality of life of their patients, advance learning and growth, and foster a culture of innovation. Mechanical engineering innovation in the rehabilitative medicine sector is all about improving quality of life of the patients and pushing technology to its limits. From an article in the Edmonton Journal, Health Minister Sarah Hoffman and Mayor Don Iveson both agree Edmonton is already well positioned to grab the title and become a hub for healthcare technology and innovation. Edmonton is home to the Glenrose Hospital, which is the largest freestanding tertiary rehabilitative centre in Canada. It serves patients of all ages that require complex rehabilitation to enable them to enjoy life to the fullest. In the most recent annual report from the Glenrose, they state that they have formed new partnerships with research affiliates working in areas such as intelligent artificial limbs to restore and extend abilities for people with amputations and human motion biomechanics. Because Glenrose research takes place in a clinical setting, as soon as the innovations prove effective, they can be put into place. This means that patients don't need to wait years to benefit from the technologies and therapies they need now. Dr. Jacqueline Herbert is the director of the BLINC lab. She has research appointments at the University of Alberta and clinical appointments at the Glenrose Rehabilitative Hospital. The BLINC lab has collaborative research projects to improve sensory motor control of advanced prosthetic systems. It has close links to the Glenrose Hospital, with clinician scientists involved in clinical amputee care at the Glenrose and in research projects related to the BLINC lab. On their website, they state that their unique combination of medical, rehabilitation, engineering, and computing science researchers has allowed the evolution of multiple lines of complementary research aimed at improving the science and art of prosthetic restoration and rehabilitation robotics. One key innovation that came out of the BLINC lab is the bento arm. From the webpage for BLINC devices, the bento arm is an anthropometric robotic arm designed specifically for robotic prosthesis training and research applications. The bento arm includes 5 degrees of freedom. This includes shoulder rotation, elbow flexion, wrist flexion, hand open and close. The arm was designed to be 1-to-1 scale with anatomical proportions and uses actuators which include integrated position and velocity joint feedback and control. The bento arm is ideally suited for machine learning and sensory feedback control. One neat thing about their research is that all of the information, including materials, 3D printing guide, electronics wiring diagram, and more, are available online, along with a forum accepting your ideas, experiences, or requests for future innovation of the bento arm. This shows the developers' commitment and openness to future innovations. The Handy Hand is another device developed through the BLINC lab. Development of the Handy Hand began in the summer of 2014 when there was an apparent need for a sensorized multi-articulated hand. Originally, Handy Hand was to be used with the bento arm and has since evolved into its own full-blown project. In the summer of 2016, they were in the process of building their third prototype, in which they were evaluating an alternate finger drive mechanism. They are planning on a hardware open source release for fall of 2016, followed shortly after by a software release in winter 2017. In an Edmonton Journal article about Alberta as a health hub, Dr. Richard Fedorak, Dean of the U of A's Faculty of Medicine and Dentistry, expressed that every day we innovate and discover something, but what we haven't done well is to commercialize it. The current strategy seems to rely more on creating a bigger culture of commercialization and increased collaboration between business and academia. The Glenrose Hospital continues to be a research powerhouse, winning several prestigious awards, initiating over 696 high-impact projects, and securing $25 million in external funding. The projects coming out of the BLINC lab are constantly improving and changing as technology gets better and better. The impact of these innovations can be huge for patients in the future. With the facilities, engineers, and talented researchers in Edmonton alone, Alberta has a huge potential to become an innovative leader in biomechanics and rehabilitative medicine.